The aim of the following experiment is to activate and study neuronal circuits long-term in awake, behaving mice. This method is adapted from the concept originally described in Sparta et al. This is achieved by first assembling a fibre optic coupler cord, which connects the optical rotary joint to the fibre optic implant. Next, the fibre optic is implanted over the brain tissue of interest to create a passage for the light to travel directly to the channel rhodopsin-expressing neurons. Finally, the light source is connected to the optical rotary joint in order to create a serially connected path from the light source to the brain tissue. Ultimately, light-induced firing of channel rhodopsin-expressing neurons can be evaluated based on in vivo electrophysiology and behavioral studies.
The main advantage of this technique over existing methods, like guide cannulas, is that it minimizes the damage to the brain tissue caused by repeated insertion and removal of an optical fiber. Though this method can provide insight into neural circuit function, it can also be applied to other systems to better understand the synapse and circuit-dependent mechanisms that underlie certain types of neurological disorders. Visual demonstration of this method is critical, as the implantation steps are difficult to master. Each seemingly minor step contributes greatly to the overall stability and reliability of the method.
Begin by cutting 35 mm of a 125 micron diameter fibre optic with a 100 micron core by positioning a wedge tip carbide scribe perpendicular to the fibre optic and scoring the fibre in a single unidirectional motion, followed by pulling straight out. Now insert an LC ceramic ferrule with a 127 micron inner diameter bore, convex side pointed down, into a vise, and then insert the fibre optic piece into the ferrule. The fibre optic should slide in smoothly and marginally protrude beyond the convex end of the ferrule. Next, apply 1 drop of freshly prepared heat-curable fibre optic epoxy to the flat end of the ferrule, and then apply a heat gun on the epoxy. The epoxy should fill the ferrule as it is heated and is cured when it turns black. After curing, clean any epoxy off the sides of the ferrule. Then, using an LC fibre optic polishing disc, make circular rotation patterns to polish the convex end of the ferrule on aluminum oxide polishing sheets on a polishing pad on 4 decreasing grades. Then, cut the fibre optic at the flat end to the appropriate length for targeting the region of interest. To test the polished fibre optic, insert the polished end of the implant into the sleeve of the coupler until direct contact with the opposing ferrule is felt. A bad implant will have a weak focal point near the tip of the fibre optic, whereas a good implant will transmit a smooth concentric circle of light with output powers of up to 10 milliwatts. Store the finished implants in foam until use. Begin this step by measuring and then scoring enough 220 micron diameter fibre optic with a 200 micron core to allow a mouse to move freely, but not allow the mouse to chew the fibre. Then, insert the fibre optic into a piece of furcation tubing with an inner diameter slightly larger and a length slightly shorter than those of the fibre optic. Now strip around 25 mm from one end of the fibre optic and insert it into the metal end of a multi-mode FC ferrule assembly with a 230 micron inner diameter bore until it stops. The fibre optic should stick out through the ferrule end. Next, secure the connection with cyanoacrylate at the metal end and cover the connection with a connector boot. Polish the ferrule end with an FC polishing disc as just demonstrated. After stripping the other end of the fibre optic, insert it into an LC ceramic ferrule with just the convex end distal. Then apply a drop of epoxy to the flat end and heat until cured as just demonstrated. After polishing the convex end of the ferrule, as just demonstrated, slide an LC ferrule sleeve over the convex end of the ferrule until the ferrule reaches the midpoint of the sleeve. Then, place a heat shrink tubing over the fixation tubing and sleeve, and heat the heat shrink tubing to secure and protect the connection. Finally, connect the ferrule to the laser source, and then test it by measuring the light output through the coupler with a spectrophotometer. The light loss between the laser output and measured coupler output should not exceed 30%. Before beginning the surgery, disinfect the surgical area with isopropyl alcohol followed by chlorhexidine solution. Next, place the mouse in the stereotaxic rig and secure the head, ensuring that the skull is level. Apply ophthalmic ointment to the animal's eyes to prevent dryness and post-operative pain. Now make an incision through the midline of the scalp to expose the cranium from the eye orbits to the lambda suture. Use seraphine clamps to hold back the skin and maintain access to the cranium. Then use a dental pick to etch a checkered pattern throughout the surface of the cranium. Wash away the resulting debris with sterile saline. After drying thoroughly, use a cotton swab to apply 3% hydrogen peroxide to the exposed cranium for around 2 to 3 seconds to create micropores. Then, wash the skull multiple times with more sterile saline and dry it thoroughly. After etching, washing, and drying the checkerboard pattern into the cranium again, insert the fibre optic ferrule implant into the probe holder and then connect it to the stereotaxic arm. Determine the burr hole location with a stereotaxic atlas calibrated to bregma and lambda. Then use a rotary dental drill to make a small burr hole craniotomy less than 1 mm in diameter above the region of interest, being careful not to break the dura or damage any tissue. Using the stereotaxic arm, position the implant in place directly above the region of interest. The ferrule should rest on the surrounding cranial tissue. Now use a sterile toothpick to apply a thin, even layer of freshly prepared dental cement across the cranium and onto the lower portion of the implant, being careful not to come into contact with the skin of the animal. The base layer of dental cement should cover as much surface area on the cranium as possible.
The most difficult aspect of this procedure is applying the dental cement without it touching the mouse's skin. To ensure success, apply small amounts of cement at a time in thin layers and wait for each layer to completely dry before adding the next one.
Apply even layers of the dental cement to form a small mound on top of the cranium and around the implant. Leave around 3 to 5 mm of the convex end of the ferrule clean of cement to allow for a smooth, unobstructed connection. Then suture the scalp over the mound of dental cement and around the implant. Vet bond adhesive can be used for additional binding after suturing. Finally, apply topical analgesics and antibiotics to the sutured skin and around the base of the implant, and then place the mouse in a cage for post-operative recovery. Proper assembly of the fibre optic implant and coupler results in minimal photon loss between the light source and the end of the fibre optic in the region of interest. Well-polished fibre optics should transmit light in a uniform concentric circle, similar to the circle shown here. As can be seen in this image, with careful implantation and suturing, the implant causes no visible irritation to the mouse, and can remain in place for long-term studies without any significant degradation of the fibre optic or to the amount of light transmitted. Functional behavioural assays in an awake mouse show a direct response from stimulation through a fibre optic implanted over the motor cortex, as evidenced by this in vivo electrophysiology video data showing the activation of targeted neurons through the implant and the behavioural response of the animal during brain stimulation.
Following this procedure, other methods like photostimulation of targeted brain regions can be performed in order to answer additional questions, such as what are the patterns of circuit connectivity associated with the target cells. After watching this video, you should have a good understanding of how to assemble fiber optic implants and coupler cords, and how to implant them over brain tissue expressing optogenetic reporters.